Good afternoon, and thank you for joining us today. You heard a lot from me last night, so I'm going to keep my comments very brief. I'm joined today by General Matt Quinn, Executive Director of our COVID-19 Task Force, and also Doc Greg Holzman, a Montana State Medical Officer. He's here as well. Today we'll provide an update on our efforts to respond to the pandemic, and then we'll take your questions. We continue to make encouraging progress in our response, and active hospitalizations continue to decline. This didn't happen by accident. It's a product of Montanans continuing to take common sense precautions to protect their health and the health of their loved ones and neighbors. It's a product of our small businesses following industry best practices and public health guidance to keep their employees and their customers safe. And it's a product of the hard work of our frontline healthcare workers who are protecting the most vulnerable among us. I'm glad to report that our efforts to vaccinate Montana's most vulnerable, our seniors, tribal communities, and those with serious underlying healthcare conditions, continue to yield positive results. Today, we are approaching a milestone with nearly 100,000 vaccines administered here in the state, and nearly 25,000 Montanans who have been fully immunized. In fact, Montana ranks 7th in the nation in getting shots in the arms of citizens. That's great news, considering we are a larger state than all the states ahead of us in terms of geography. We are working hard to reach all of Montana with this life-saving vaccine. We're making progress, but we need a greater supply of vaccine from the federal government. We've achieved great efficiencies in getting vaccines administered. We're doing a terrific job, as the CDC data show, but we're not being rewarded with an appropriate dose allocation from the federal government. Montana is receiving one of the lowest weekly allotments of vaccines per capita. In fact, according to the CDC data, we rank 45th out of 50 states in terms of number of vaccines per capita the federal government is sending to us. This needs to change. Yesterday, I sent a letter to President Biden encouraging him to ramp up production and to send us more doses as soon as possible. We need them. We've proven that we can get shots into arms successfully, and it's absolutely critical that we get more supply to protect the most vulnerable amongst us. Now, I'll turn it over to Doc Holzman to speak about the state's efforts. Thank you, Doc.
Thank you, Governor. We are very tired of this pandemic. It was just over a year ago, in January 21st, that we had heard about the first COVID within the United States. And it was in March that we started to have the first virus recognized here in Montana. It has been a long haul that has affected every one of us in many different ways. That's why on December 14th, when we had the first vaccines delivered to Montana, that was an inspiring day. We could now see the light at the end of the tunnel. The vaccine is how we are getting out of this pandemic. We share with Governor Gianforte's hopes with vaccines now getting into the arms, but we are also not stopping or relaxing until we have enough vaccines to get everyone who can be vaccinated, vaccinated. As I have stated in many times before, this virus has had a devastating effect on our state. This is why such limited supplies of vaccines currently, and with such limited vaccines currently available, the governor has decided to make sure that healthcare workers and those that are most vulnerable get the vaccine first. We highly support this. The governor's approach of getting these most vulnerable vaccinated will save lives. And the medical and public health communities are working hard to make sure this gets done. Still, we want the public to be aware that supply does not meet the current demand. That is not stopping us. We want to make sure that all the vaccines that come into Montana are getting into arms quickly. But our current supply from the federal government limits our ability to give everyone the vaccine today. But we don't want to hold on to it. We're going to get it into arms. As the governor said, we have administered over 99,000 vaccines, and more than 24,500 individuals are fully vaccinated. As you remember, both the Pfizer and the Moderna vaccine is a two-shot series. This gives you an understanding, though, of the supply issues. On January 26, DPH was notified, as we are each week. So basically on Tuesdays, we get a notification from the CDC about what will be allocated to our state. We are going to be allocated for next week 15,625 first doses and 6,300 second doses of vaccines. These doses will be distributed on next week, February 1st. So we get the notice on Tuesday. We work with all our local public health and the areas to see who needs what vaccines. And then on late Thursday or Friday, we send in our order to the CDC so those vaccines can be delivered to the right places the following week, Monday, Tuesday, and Wednesday. We always order the full amount that we can get from the federal government. This is an increase when I give you the numbers that are coming in next week of 15,625, because last week we got 13,525 vaccines. So we're moving in the right direction. But it also means that that's only the amount of people that we can get a first vaccine dose into next week. It's a small increase. The good news is that we suspect the vaccine supplies will increase as things are moving forward at the federal government, and is encouraging. And we also know that just this week, Johnson & Johnson, which is another vaccine company, has released their data to the FDA, and we're hoping that that will get approval and an EUA, which will add another vaccine to our stash of vaccines that we can give. And this vaccine is exciting because it's a one-shot vaccine. So if you fit into one of the categories right now, in that 1A or 1B category, that makes you eligible for the vaccine, please contact local public health or in your area, the vaccine center. Some places are doing it slightly different, to find out when you can get the vaccine. But I think it's very important and very important that we are completely honest with you all. That does not mean everyone that is in 1B will be able to get their vaccine next week. We don't have the supply for the demand that's there. But it's important for you to know how you can get the vaccine, to get on the list that may be available within your communities, and know where to go to find that. And get starting on that right now is a good thing to do. If you don't know where to contact within your own county, you can go to our website, which will give you listings of where these sources are. I would be remiss, without being the public health physician that I am, to say that as we wait to get everybody vaccinated, that it is very important that we continue to do non-pharmaceutical interventions to protect ourselves and protect those around us. We highly encourage people to wear their mask, to stay socially distanced or physically distanced, to limit your being in crowded areas where you can't be socially distanced or where there's not good ventilation. And of course, it's always good to continue to wash your hands. One of the positive effects on all this is we have not really seen flu this year, which is amazing. So in Montana, as the governor so well stated, our case numbers have come down drastically from the peaks that we saw in November. Our hospital numbers are just over 100, which is so much better than when we were running around 500. The pressure has come off, and we want to keep it that way. So as Governor Gianforte, and as we all say, we are not out of the woods yet. So please keep vigilant, get vaccinated, and when it's your turn, and just know that there is a light at the end of the tunnel, and it gets brighter each day. Thank you.
Thank you, Doc Holzman. I'll turn it over now to General Quinn to address the vaccine acquisition and distribution process. General Quinn.
Thanks, Governor. So Doc Holzman walked through a little bit. I'll cover it again, just how the process is working from the federal government down to the state. So on Tuesday, we get told, here's what, Montana, your allocation of first and second doses will be for the following week. We go into that then with the expectation that those will be delivered that following week. We work between Tuesday and Friday with local public health and the hospitals to allocate those resources, and that'll be broken out between Pfizer and Moderna. You all will remember Pfizer comes in 975 to a packet. Moderna is broken down a little bit more into 100. By Friday, we have to submit then to the federal government. Here's where those allocations will go. Montana, as Governor Gianforte has mentioned, every week that we get the allocation, Montana has maxed out the allocation that the federal government is saying that we can order. That's not true of all states, but certainly Montana is taking advantage of that order. So Friday, we submit to the federal government. Here's where we want all of those vaccines to go, both the Pfizer and the Moderna shipments. Those start showing up the following week. Some arriving as late as Thursday of the following week. So we take a look on Monday at what we had received, and that's what the hospitals, the frontline medical workers, the local public health can administer at that time. You know, as Governor Gianforte said, we are doing very well. Almost 100,000 shots in the arms of Montanans. Again, we're 7th in the nation in terms of getting shots in arms for the vaccines that we've received. We could use more. We're hearing from the counties out there, they could use more, and so we continue to push the federal government to get more vaccines into Montana so we can take care of the most vulnerable. Thanks, Governor.
Thank you, General. And now we'll open it up for questions. Holly, would you like to go first?
Yeah, I'm wondering if you could talk a little bit about, or maybe someone else could speak to this, but how the federal government determines what states are eligible to get, if it's based on population, how well the state's distributing it, and then if there's a number, sort of a maximum dose that you think Montana can distribute in 1 week, like what would the most coming into the state per week you'd like to see?
I'll address the second part of that, and then I'll turn it over to General Quinn or Doc Holzman. We did poll hospitals, public health officials. They could accept at least double what we're currently getting and be effective in the distribution. Do you want to talk about allocations?
Holly, for allocation, I wish I had an answer for you. You know, we looked at the chart as to per 100,000 how many doses are coming into Montana. Again, we were 45th out of 50 on that list. So we're not sure how the federal government is coming up with the allocation per state. As Governor Gianforte mentioned, he sent a letter to the president asking to increase our allocation. Hopefully that will have some effect. But it's right now some art that we aren't able to read into as to why we're getting what we're getting.
And just to put a number on it, I've been so proud of the work that General Quinn and the entire team has gone. This week, based on the reporting, 87% of the doses we've received in the state are in people's arms. So there is very little lag. We're getting this out, and people are getting vaccinated. Can we take a question online?
A question for Governor Gianforte and are dialing in. Please dial 5-star. Question.
Okay, another question? Zach?
Sure, Governor Gianforte, Zach Kaplan, Montana right now. You mentioned you reached out to President Biden. You sent the letter to him. I'm wondering, first off, if he's acknowledged that letter, and second off, if there's been any indication at all about potential incentives for states like Montana that are being relatively efficient with the vaccine distribution.
We have not heard back yet. As Doc Holzman mentioned, next week we'll get an increase of about 2,000 doses, but that falls woefully short of what we could actually use.
And then a follow-up for Dr. Holzman. I'm just wondering about the Johnson & Johnson vaccine a little bit. I'm wondering if you've heard at all regarding the efficacy of the vaccine and just how important it will be as far as getting people vaccinated in the state, the fact that it's a single dose rather than, the 2 doses a month apart.
Yeah, it's a really good question. I don't have a specific answer for you. I have not read the literature out on it. I've seen what's been in the lay press as far as an efficacy on this through the studies. But I think the bottom line is all these vaccines that we're seeing will be beneficial and helpful, and it's important that people get vaccinated. The idea of having a 1 shot versus 2 shots is with all the series that we have for serials on vaccines, the more you add into it, the more challenging it is to get people back and get them back at the right time. So this is another wonderful thing to add to our toolbox. So I'm very excited that it's here, and whichever vaccine is there ready for me with the time that I'm ready, that I'm available and in my group, I will go right in there and get vaccinated.
Okay, we'll take a question online.
Hi, Governor. This is Catherine Houghton with Kaiser Health News. I know that Billings Clinic is now testing for potential COVID variants. I'm wondering if the state has an idea of how many other locations have that capacity, and also whether that's something kind of on the state's radar for its lab, that form of surveillance.
Thank you, Catherine. I'm going to ask Doc Holzman to address that, if you would.
I can't give you the specific numbers offhand, but if you want that, we can look those up. But we do send a certain small number of viruses that we get to the CDC to do some of their surveillance on. And then if we have an unusual type of case, those are also ones that we'd want to think about getting to the CDC to evaluate. So somebody that we might know is possibly a reinfection, or somebody who actually gets the virus after they've been vaccinated. These are important things that we'd want to send along to continue that surveillance of looking out in the area and seeing if different vaccine variants have come to Montana yet.
Okay, we'll take another. Yeah, Jackie.
Governor, Jackie Coffin from Montana PBS. So I'd like to ask any of you about some of the numbers. You said 100,000 doses administered, 25,000 people vaccinated with both in the series. Does that include vaccines given by IHS or the VA? Is that a total number of Montanans, or just vaccines administered by the state?
Yeah, General Quinn really pulls the dashboard together, so I'd like to have you address that, if you would.
So those numbers that were provided exclude the federal partners that are out there, and I would remind you that the federal partners include the VA system here in Montana, as well as Indian Health. But the numbers we got from Indian Health this week were 5,234 first doses, and then 1,258 second doses, and they've received about 9,000 doses into the state. IHS is doing a very good job of vaccinating our Native American population.
And a follow-up question quickly on that. As we're 7th in the nation for administering vaccines, is that kind of a median number for across the state? Are there certain parts of our state or communities that are behind or struggling more in administering vaccines?
I certainly wouldn't say they're struggling more. If you recall, 1A included our frontline medical workers, and so we have communities with a much larger number of frontline medical communities, so they may show a little bit higher in terms of total number of vaccines. But as we look at a tray of 975 and we look at a tray of 100, how to allocate those things out. And if you recall, as we started, the Pfizer is kind of a touchy one to get out there, required ultra cold storage, right? And so we have to try to allocate that amongst the communities, and we have a team over there worked very hard to allocate. So really would not say any community is struggling. All communities would like more. We're struggling maybe trying to get them the vaccines that they're looking for.
Thank you.
Thank you.
And Jackie, I would just point you to the updated dashboard that the state, we're providing complete transparency here. You can look at that chart and see how many people per 1,000 have been vaccinated in each county in the state. and the color coding will show you where it's more dense and less dense, but as the general mentioned, sometimes it has to do with how many healthcare workers are in that community. They'll start to even out as we can get more vaccine into the field. So we'll go online.
Hi, Governor. This is Caitlin from Yellowstone Public Radio. I don't know if this question is better for you or General Quinn, but I'm wondering if there's any indication if not getting the same rate of vaccine per capita has anything to do with us also being seventh most effective at getting the vaccine out, or if that seems to be maybe more something related to population, like we have less public transportation than other states. Is there any idea of what might be causing that? Are other states behind us getting more vaccine as a result to get those healthcare workers vaccinated?
Personally, I think good behavior should be rewarded, not penalized, but I'll let General Quinn address that.
Yeah, again, there's no clear reason as to where Montana is falling in terms of the vaccine allocation. I think North Dakota is right above us in terms of the allocation, and if you look at two states that have kind of had a different response to the COVID-19, Montana and North Dakota. So we really don't have a clue. There was some talk initially that maybe your rate of vaccinations, getting shots in arms, how little vaccines are sitting on the shelves might weigh into it. But the later word that we heard on that is that they aren't going to do that, but it will be population-based. And again, doesn't appear to us that it's population-based or a per 100,000 population, so we're still trying to work through that. And we will just continue to push CDC to get a fair share for Montana.
Yes.
Eric Dietrich from Montana Free Press. I think this is probably for General Quinn, but is the dashboard, does that include the IHS and other federal agency numbers, the VA, the state?
No, sir.
It does not.
Great, thank
Yeah,
you.
that's a separate channel, so that's in addition to what's shown on the dashboard. We'll go online for a question.
Yeah, this is Antonio Gonzalez. I'm no business owner. I'm no anybody special. I'm just a citizen in Montana. But I've been hearing a lot of different things about this COVID, and I got a question. This is a straightforward question: is a lot of us are tired of this pandemic. So you guys also are. But have you guys looked at the mental, physical, economic, and the health guidance? The representatives, I think they have too much power, and they're telling us people here that have a problem with this. We feel like the power is being overreached to the public. And you said that less government is better, but there's still government involved in all this. And, you know, we the people need to get our freedoms back and freedom of choice to wear one or not. So why is it we continue to have to be told what to do and be treated like children?
Well, thank you for the question. I mean, I think it's important that we all pull together as neighbors to get through this. And I've taken steps since I've been in office to simplify the regulations, peel back what we thought were arbitrary restrictions on business in terms of hours of operation. And I've made very clear, no one wants to get rid of these masks more than I do. And I've made that path very clear. We need to get the vaccine out to the most vulnerable, and we need legislation that'll protect small business. I'm pleased that that's moved through the Senate. It's currently being considered in the House. I look forward to signing into law and taking my mask off and throwing it in the trash can and going about life in a safe manner. So thanks for the question. Holly, you have a question?
Yeah, I'm wondering on the lifting of the mask mandate. I know you said that within the Group 1B you want to see that group vaccinated. I'm wondering, just understanding that not everyone eligible will want to or get the vaccine in that group. How do you sort of tell when we've hit that threshold? Is there a number, and are you looking to counties to let you know that they've kind of moved through that group? Just trying to get a better understanding of how you know when we're at that point where it's met what you want to see to lift the mandate.
Yeah, there's a number of factors that go into that, Holly. We'll do it in consultation with medical experts, talking with our other advisors. I'm encouraged that, as Doc Holzman mentioned, hospitalizations continue to come down. We have relaxed the business capacity and hours of operation. We want to make sure that doesn't set us back. We need the lawsuit protection. We need to make sure the most vulnerable are vaccinated. I'm encouraged that this week virtually all long-term care facilities and nursing homes will have had at least one vaccination clinic, with the second one scheduled. So the vaccine is getting to the most vulnerable. As we've said clearly here today, though, we need more. We have the distribution to get it out, and those factors will all go into making that final decision.
One follow-up on that might be best for Dr. Holzman, but wondering in terms of the declining hospitalizations, what he's seeing in there that he attributes that to. Is it kind of what he's noticing?
I think there's a lot of factors that play into it, and I couldn't tell you any one that is specific for it. But I do believe that the vaccines are going to make a big difference. And even after the first vaccine, and as you go the further and further away from that day that you got that vaccine, you start to get some immunity. So, and we're hitting those people that are more likely to end up in the hospital or have a worse condition if they have an outbreak, if they get the virus. So that, I think, is one of the strong reasons to continue in that process and try and get more and more of those people as soon as we can that have high risk to get vaccinated. And that hopefully will keep down the stress on our hospitals. I also think many Montanans are doing the right thing and caring about, it's a matter of using the science and caring about the people around you. And I think people are really trying to do that. I think we've all gotten a little bit more used to some of these aspects that we have added to our lives and look forward to the day that they'll be gone. But that, I think, has been really well. And there's a new study that came out, this is from The Nation, but looking at schools. And I would say the same thing here in Montana. Our schools have done extremely well. You do get cases. That doesn't mean they got them in school. These kids and parents and everybody doing different things. But you're not seeing, the schools have been so good at responding and using the contact tracing and everything else to really control these things. So I think there's been a lot of positive things of Montanans working strong together.
Thank you, Doc. Jonathan, did you have a question? Okay. Do we have a question online? I just don't want to leave you out.
Governor Andy Viano at the Flathead Beacon. I want to go back to last night. If I may, you announced the state would be seeking to dismiss lawsuits against 5 businesses here in Flathead County. There are pending counterclaims in that case, and I'm wondering, in light of that announcement last night, do you have an expectation for how those counterclaims will be settled going forward?
Yeah, so thanks for the question. That is true. In my State of the State, I was very clear. It's been a tough year for small business. We don't need government piling on. I believe that's what happened in these 5 cases up in the Flathead. I've directed our general counsel to dismiss these cases. Those discussions are underway, and I look forward to getting them resolved. So I want to thank everybody for being here today, and the light at the end of the tunnel is getting brighter. Thank you.